Welcome to the Capstone Conversation, where you learn about what's happening in the greater East Bay. I am your host, Jared Asch. Today, I am joined by three people who are smart and compassionate when it comes to caring for the seniors in the greater East Bay community. We are going to dive into senior policy, senior care, and how we as individuals can prepare for an aging population that is happening here in the East Bay and throughout America. I am joined by Meyer, who is with Empower Aging and is the executive director there, but she has a secret side job where she is mayor of the city of Brentwood and a two-term councilwoman before that. We have Debbie Toth with Choice in Aging, and Matthew Hulse, who is with Contra Costa's Senior Legal Services. So thank you all for being here today. Can you tell us a little bit more about yourselves as individuals and your organization? Susannah.
Thank you, Jared. Thanks for having us today. I think it's a very important conversation and a good focus area considering the aging population. I've been with Empowered Aging for 3 years. And prior to that was with Meals on Wheels Diablo region, off and on for 10 years. I'm sunk into the world of aging and disabilities and love this work and love advocating for this population. Empowered Aging's primary program is Ombudsman Services, which means we are state mandated to offer protection and advocacy, support quality of life issues, prevent neglect and abuse in long-term care facilities for aging and people with disabilities in the Contra, Costa, Alameda, and Solano counties. In addition, we have a healthcare career pathway with a CNA certification, and then we have an MSW internship program.
Debbie?
Jared, thank you so much for having us. I am thrilled that you're covering the topic of seniors and aging because I think that is such an acknowledged and seen population, even though it is the largest growing segment of our population. Choice in Aging is a nonprofit organization based in Pleasant Hill, but we provide services in Contra Costa, Napa, and Solano counties. Our primary driver is providing services and support that allow people to age in the community in their setting of choice with dignity and joy. We do that with adult day healthcare, complex case management, transportation, caregiver support, policy advocacy, and so much more.
Matthew?
Thanks, Jared. Really appreciate being here. I am brand new to the aging space. I've been in the aging space for 1 year. I work at a little organization, your friendly neighborhood legal aid organization that has the best free attorneys in Contra Costa County. We serve exclusively this one county, unlike my esteemed counterparts here today. We only serve those that are 60 and above, but we are here to provide protection. Not every day do you need a lawyer, but the day that you need a lawyer, there's not anything else that's going to solve your problem. We're here to keep our older friends and family safe and housed. We do a lot of work keeping landlords following the rules, following the law, and making sure that elders are safe in their homes. Someone once said, I think it was Debbie, that you either have a family member who's older or you are older. This is something that affects every single person. Everyone listening to your podcast, Jared, should care about their family members who have already reached this age, if for no other reason than because they're going to be there soon. And it'd be nice if we lived in a world that took care of us all when we got a little older.
Define what older is for today.
For my agency, it's 60 and above, but Susannah and Debbie may have a different threshold.
Yes, that's a fantastic question, Jared, because that comes up so often. We look at statistics all the time. People who are 60 and older are going to be 25% of the population by 2030. People who are 60 and older don't necessarily get HUD, which is 62 and older, but they get older Americans, which is 60 and older. But if you're ARP, it's 50 and older. But wait, if you go to Ross Dress for Less, it's 55 and older. I want to promote you all going natural with gray hair because you get discounts before you qualify for them. But seriously, like, this is a good question because the IRS for your minimum mandatory distribution looks at age 70, right? So everything, Medicare looks at 65. It's a really good question. I think when we talk about older adults, we're talking about folks who are no longer perhaps in the workforce. They are folks who are starting to age into disability or need services and supports that help them live in community. For our programs, I think for Susannah and Choice and Aging programs and Empowered Aging programs, we're serving adults that are 18 and older. It's just that we're predominantly serving older adults because that is the largest chunk of the population that is at risk for institutional care, is in institutional care, is living in boarding care facilities.
Yeah, we do focus more on the 60 plus population. I was going to mention senior centers. You can belong to a senior club membership at age 50. We also serve the disabilities population of 18 to 59, but not as our primary goal and mission. We are more driven toward older adults living in long-term care facilities as our primary.
And as another reference, you could live in Rossmore if you're 55 and up. It is one of the largest senior adult communities here. But I think that's considered active adult and not necessarily senior, even though it is designed that way.
I'm well into receiving discounts, unfortunately, or fortunately, depending on how you look at it. All of us who are around at this age are lucky to be here. Let's face it. Pretty much your goal is to be elderly.
So let's talk about this big picture in our communities. We have seen the baby boomers and the aging population, but what we also see is a trend throughout California, and this goes to the housing crisis, is a lot of younger people moving out, right? So we're Silicon Valley, we're San Francisco, we're a young, hip area, but we are seeing trends where younger people aren't buying as much in the community. There's a slower turnover. Talk to us in each of your words. Debbie, maybe you go first this time. What is that bigger picture in our communities? How is it impacting things? And what are key issues?
Around just the aging population in general, I think it starts with ageism. We're all ageist. We all have internalized ageism. We also have externalized ageism. I think that we are in the current state that we're in, and that state is we don't have a long-term care system. We use those words, but we don't have a system. It's different from county to county, from city to city, from state to state. You can't age and then leave. Okay, I'm going to leave Contra Costa now because I can't afford to live in the Bay Area because it is really expensive. And you move somewhere else, you're not going to find adult day health care, or you're not going to find that the Meals on Wheels is to the zip code you're living in, or you're not going to find that you have paratransit because you don't live within 3/4 of a mile of a fixed route bus stop. So we have this lack of a system. I call it our institutionally biased poverty pipeline. You spend every penny you have to stay living at home and get the support you need. And when you're out of money, you get put into a skilled nursing facility, or you go homeless, which is the largest growing segment of the population. Age cohort of homeless folks or unhoused individuals who are homeless or unhoused due to poverty, not due to substance use disorder, not due to a mental health condition. This is the first time in our history seeing that it's just from poverty. I'm painting a pretty dim picture, but it's because we don't prioritize this population. We haven't planned for it. Last century, we gained 3 decades of life expectancy, and we did nothing to plan for it in our healthcare system, in our lack of long-term care system, even in our built environment. If you think about it, a grandma or a grandpa or an older adult may be using a walker or a wheelchair to get around. And if they take their grandkids to a park and that swing set is in a sandbox, they're not going to be able to push their grandkids on a swing. So we have a real crisis right now because it is the largest segment of the population. And based on the needs that happen as we age and how costly they are, we put people in hospitals and skilled nursing facilities before we prioritize funding services in the community, which save money. We're headed for disaster, Debbie. And I also want to add on the point of ageism and how it controls everything. Think about how many times you've heard the term silver tsunami to talk about the baby boomers. What other group or cohort in our population could we call a natural disaster and it's okay? Right? I mean, it's in everything. It's baked into everything. I don't know if others have thoughts on that.
I would have to agree. Ageism is really disabling our ability to serve the population that we need to serve, especially considering the growth We've heard the term missing middle. And in aging and disabilities world, there is very definitely a missing middle through which you don't qualify for this, but you're overqualified for this, and you don't make enough money for this, but you make too much for that. And it's absolutely true. And as Debbie said, the further away you get in your living circumstances so that you can afford to live where you want to live, the less access you have to resources. When COVID hit, and we're still learning from COVID at this point, we found out about all of the people that we weren't reaching. Meals on Wheels was not delivering to these people. They were not going to senior centers, and they were not getting access to legal services or day programs. These are still a lot of people we're missing that we're not able to connect with. And unless someone brings them to the resources, not going to them. So I think with Debbie, I hate to paint this really dire picture, but we need to talk about this. And we really need to honestly make sure that our nonprofits that are serving these needs are able to fill in any gaps and able to do the work they need to do within a capacity that makes sense. Because every nonprofit leader I know says their teams are stretched beyond capacity. They don't have the amount of staff that they need. They can't fund the programs that they need to fund and still pay the rent where they have to have a place to actually get the work done. Our system is a bit broken in this way, for sure. I'm sure Matthew has some things to share too on that.
I think, Jared, the one thing I'll add is we have a much more mobile society than we ever have in the history of our existence. There may have been a time when the older generation was cared for, and there are countries where every older person lives with the family. But that's not the case for most people in the United States. We all live separately. We all move out. We all look forward to the time when we can move out from our parents' home. So the grandparents in our communities are expected to be on their own, not living in the homes of their kids. The responsibility for them becomes very diffuse. And it's one of those things where if it's everybody's responsibility, it becomes nobody's responsibility. And so even if you, Jared, are feeling like, oh, I'm taking care of my parents, there's a lot of parents and grandparents out there that no one is caring for. What I think is incumbent upon us as a society is to say, look, all grandparents are everybody's grandparents. We all need to step up and make sure grandparents age in dignity and have what they need, because it's just right. If it was your own family, you'd be embarrassed if they were on the street. But if it's some random person that you don't feel connected to, you think, oh, that's not my fault. But I think the responsibility gap really needs to change in our minds. It's partially the fact that we value them less because they're older, but it's also we value them less because we don't think they're ours. But I think they're all ours. That's my message for today.
I think you bring up some really good points, but I also want to compare the ageism that we're all talking about here with the other isms, because so much of this is about education and transparency and communication. In fact, Debbie can talk about some wonderful things she's doing to bring up children that are very exposed and understanding of the aging population and inspired by and friends with. And I think that's one of the things we're not doing very well. We're very divided. A lot of our young children have their grandparents living across the country, so they have no exposure to older people. It's a big mystery to feel divided and separated. And there isn't an understanding. I used to do talks with kids when I was with Meals on Wheels, and we talk about how the outside looks very different, but the inside is still the person that they were when they were a kid or a teenager. If you used to love chocolate and hate pickles and tell dad jokes when you were 5 years old, there's a chance you'll be doing those at 85 years old too. The core of the person is still the same. It's just the shell that looks different. And we need to really educate people on that, because it shouldn't be such a mystery and it shouldn't be as divided as it is.
I love that. And I am often baffled that there's some magic marker to a certain age where you become invisible and you don't matter anymore. What is that age? We have carved grandma and grandpa out of the family, out of having value. And yet they have the one thing you can't buy, which is life experience. You can buy a fancy car, a fancy house. You can do whatever to your face. You can dye your hair. There's so much that you can buy. You can't buy life experience. That treasure lives in older adults. How is it that we're not honoring and elevating?
I did a podcast episode a few months ago with two Generation Zs and a millennial politician. Tessa Rudnick, who was then mayor of El Cerrito, talked about being in the sandwich generation, where she is having to not only raise her kids, but help her parents with a lot of stuff. That's difficult. My wife's parents live an hour away. My parents, divorced, they live literally across the country. It is a 6-hour plus plane flight to get to visit them. That becomes harder for them right now. They can get here, but I can see that being different in 5 years, where we have to make all the trips there.
Yeah.
Talked a lot about services and what's missing. You all talk about staff that's overworked, and there's a number of other senior organizations that you all partner with. I think everybody does a good job of collaborating, but what are we missing? Mayor Meyer, you had talked about at Meals on Wheels that you missed a whole group of people that you learned about in COVID. Where are those other gaps of services in the counties that you all cover? Whoever wants to go first.
When COVID happened, I was not actually with Meals on Wheels. I was referring to Meals on Wheels as one of the agencies that was doing its best to reach the unreachable, count the uncountable, and find the hidden, missing, and overlooked. That was a challenge across the board. The ones living in long-term care were the ones we actually knew were there as ombudsmen through Empowered Aging. But of course, being able to deliver the service and the advocacy and the empowerment that we do on a regular basis was impossible. I still wonder, how prepared are we if this happens again? We learned a lot of things, but did we learn enough to be able to serve some of the most vulnerable people that we lost during that horrible time?
No, the answer is no, we didn't.
Yeah.
I think what we saw was a response that paralleled what we have been seeing all along. We don't have good care for older adults. We don't have sufficient space, programs in community. We don't have sufficient oversight of our licensed care facilities. At least in Contra Costa County, we saw a really strong response from health services. They immediately went into emergency operation mode. Dr. Levin led strike teams that went into the skilled nursing facilities, brought PPE, trained the staff on prevention of spread and containment of spread. Like, we saw things that we had been hoping to see for 50 years in the industry. That's gone. The strike teams are gone. The training is gone. The support with PPE is gone. Like, all of the things that they stood up to do to care went away. And not because Contra Costa Health doesn't care, but because all of the funding that was coming in response to the pandemic allowed us to do things that we couldn't do before. We saw what it could look like if we were funded, and then the funding went away, and we're seeing that we're back to status quo.
The numbers during that time rose in this amazingly quick way for the people needing the service. Those numbers did not lessen when COVID was over, if you will. The numbers are still way up here, but the funding went back to where it was before. That's it. Yeah.
We have over 160,000 older adults living in Contra Costa County, and we have 2 licensed adult day health facilities. One has a capacity of 70 and the other has a capacity of 60. We lost our adult day health care program in West Contra Costa because funding was insufficient to keep their doors open. This is a community-based alternative. Somebody who was living in a skilled nursing facility and then was transitioned out the following year, there was $85,000 saved with Medicaid dollars with them living in community. We spend so much more money to have people living in institutions, but the agencies and the programs and the services that keep people out of them are radically underfunded and can't keep their doors open. That is a massive gap. And I think Matthew probably has some really interesting information about what happens when folks lose housing because they don't have attorneys to help them not get evicted. That's what you hear a lot. And Matthew, I'm assuming in your world, that's a primary driver of your calls, right?
It is. And Debbie earlier referenced to the fact that the senior homeless population is the fastest growing segment of our homeless population. And there shouldn't be any seniors becoming homeless. We're a small county nonprofit. We're barely reaching a seventh of the major legal issues that are out there at the level of resources that we have currently. 1 out of 7, we're able to help them and keep them in their home. And if that's adequate, then let's leave us the size that we are. But if you're not happy with 6 out of 7 adults with a crisis legal issue just having to go without. The percent of landlords who go to any sort of dispute with a lawyer in tow is huge. It's north of 90%. And the percent of tenants that come to any sort of dispute with a lawyer is 7%.
Wow.
There's
Yeah.
just this huge gap in resources. People are like, I guess I'll just do whatever the landlord says, even if the landlord's in the wrong.
And can you help with, out of that 6 people that you're currently not able to get to or fund, could you have helped 5 of the 6 stay where they are?
It's almost 100% of the folks that come through our office, even if they're getting evicted, we can at least get them a soft landing, which is a new home that's stable and that's affordable, even if the place they're at isn't going to work for whatever reason. And a lot of times it is going to work. The landlord just isn't willing to do the thing that needs to happen. Maybe a ramp needs to go in because the older person now is with a walker or with a wheelchair and they can't get to their bathroom anymore. If a lawyer writes the right letter, the landlord helps put in the ramp. But even if we can't keep them there, we can help them find another place to go. And it's nearly 100% of the time that we're going to get them into safe, stable housing.
I want to mention too, if we're talking about capacity, Alameda County has over 15,000 residents living in long-term care facilities that we directly will be available to if they need our support. We have 3 ombudsmen to cover the 7th largest county in the entire state. Things are going to slip through the cracks. Staffing is underfunded for the facilities themselves. They're all understaffed. So it's really the recipe for disaster. The other thing I want to say when we're talking about homelessness is we have affordable housing for seniors is almost non-existent. The wait lists are years long, but new housing developments are coming in for seniors and developers are paying in lieu fees so that they don't have to build anything affordable. You'll have a complex of hundreds of units for seniors and not a single affordable unit for a fixed income resident. It doesn't make any sense. I think that's part of it. That's the prevention end of things. Not only that, but like the healthcare costs, for example, and what Matthew was talking about with some sort of modification needed to keep someone safe in their home. Can they afford to actually do that? Medications are so expensive. We're setting up a recipe for disaster.
And it's not an isolated incident that an older adult has to make a decision whether or not they're going to have food or medication. They are making decisions about whether or not they're going to feed themselves or take their medicines. And that is real and that is daily. And that's wrong.
Is that the lower income population? Help me understand this. Are we talking about 85% of seniors? Are we talking people who were middle class and in a decent home, 2 income earners? Or are we talking about a smaller?
The Department of Aging just put out a 2020 profile of older adults in Contra Costa County, and it said 9% live in poverty. It
Okay.
also said 55% of low-income households are housing cost burdened. There's others, like 20% are living alone. These are age 60 plus. Well, once you're a certain age, you're not working anymore, you're retired, so your income is pretty much at a set pace. It doesn't take much to put someone over the edge and to make it so that they have to make those choices that Debbie is talking about. It could be the rent increasing exponentially. It could be anything that would put someone over the edge where they can no longer afford to live independently or afford to be in the home they're currently in.
There was a recent study, the most comprehensive on older adult homelessness done through UCSF. Dr. Margot Cushell led the research over years. One of the seniors that was unhoused noted that $100 a month could have made the difference between losing their housing and keeping their housing. And if you think about it, Jared, before when I referenced that we gained 3 decades of life expectancy, we didn't plan to have this much life to pay for. It could be middle income people, upper middle income people, because you have one health disaster and you go bankrupt on medical bills. Like you have one tiny thing happen and it changes the entire trajectory of your life. Not to mention that we didn't plan to be retired for 30 years and have to live on a fixed income because our income is fixed, but everything else goes up. PG&E goes up every year. Our water bill goes up every year. The cost of groceries, gas, all
Rent.
those things go up, right? And our landlords can just continue to increase rent, right? And interest rates if you're paying a mortgage, like all of these factors, like life gets expensive. But if you think about it too, and I'm going to bring us back to ageism because we don't talk about retiring and we don't talk about saving. We don't talk about getting old. We don't talk about it in school. We talk about getting a driver's license, getting a career, getting married, having children. Like every other life thing we talk about, we teach. We do not talk about aging. We actually spend more time preparing for a 1-week vacation than we do for the 30 years of retirement. No joke, right?
Yeah.
Wow.
We're all being Debbie Downers, not just Debbie.
You talk a lot about resources already not being enough. Let's talk about the budget situation. And you talk about how in COVID it peaked up and the schools felt the same way. And then things have evened out. What are some thoughts on budgets now? Where are those constraints? And let's put aside for the moment, there's the freezes on all the federal funding and a $4 trillion deficit budget cuts coming. Talk about where things are at now in terms of budgeting. What are some of the problems? Are there easy fixes? Help explain this problem as it is today. Matt, why don't you go first?
Before you do, I ask that the audience hit subscribe on your favorite podcast app. We now have more than 70 episodes on important issues in the East Bay.
Jared, just take on the major issue there. Let me pick out a little bit of a metaphor. We've all looked at the fact that the Social Security math doesn't make sense. And we've been hearing for decades and decades that Social Security is not sustainable in the long term, that it's got this budget problem. But how eager have our brave legislators been to tackle this problem and to come up with a solution? Not at all. They keep putting it off. They're going to wait until the whole thing blows up in their face and there isn't any money to pay Social Security. Because it requires planning, it makes you think about end of life and these difficult issues. The point that Debbie made earlier, we don't like to think about the end of life. We don't like to plan for it. We have to grow up, Jared, and put on our big boy pants. In my case, big girl pants, different gender, take these things on. And I think as a society, what we're trying to urge here for any policymakers listening to your podcast, the earlier you start planning, even if it is just for a 1-week trip, the better. You plan as you're heading out the door to the airport, you're going to be screwed. You're not going to remember all this stuff. But if you plan earlier, you have a chance of getting all the things that you need for your trip. And that's the case for getting older as well. If your wife is going to retire at 60, maybe if she does enough planning, that's possible. But who knows? If she doesn't plan at all and then just, waits until 60 and then just suddenly retires and doesn't have the money to cover all the things she wants to do, that's a recipe for disaster. The urging, I think, is let's count the costs, figure out our priorities, and if caring for our seniors is a priority, then let's make a plan. The Older Americans Act, which founded Meals on Wheels and created elder legal services that I'm a part of, had in mind that there should be some services, but they didn't plan that those costs would grow or that the length of time we'd have to provide these services would grow. And that lack of planning meant that the money didn't change very much, but the needs grew and grew every year. The Older Americans Act may have been somewhat sufficient when it was first passed in the early 60s, but is woefully under-resourced at this point to do what it ever started out to do. It's a matter of being adults. I think kids don't plan, right? They just walk out the door. They don't take their jacket with them. But adults, we're supposed to be able to think ahead and think, oh, it might rain later. I'm going to take a coat. Let's just be adults as members of society and plan. What's important? What do we need to plan for? Let's just be adults and do what needs to be done. That's my recommendation for our podcast.
Big human undies. That's what we're going to say.
Thank you. I needed a better phrase.
Yeah, a big
Ben,
human
this is about seniors, so we're going with the Ben.
I'm looking forward to the fact that I have those as an option. My grandma, she didn't have those as an option, right? So at least now we have better products and supplies because Procter and Gamble found out there was a way to make money off of it. So anyway, I want to talk about budget on the national and state level and the brokenness that is the way that we budget as state and nation, because I think that is a key factor in why senior legal services, why ombud services, why Meals on Wheels, why transportation, why all the things that older adults need are radically underfunded. And that's because we do some really odd smoke and mirrors with our state and national budget where we don't actually look forward to see if we spend money on this, does it save costs in the next year and the next year and the next year? So as I mentioned previously, we learned that if you transition somebody on Medi-Cal out of a skilled nursing facility, there's transition costs. But the second year that they're out, there's an $85,000 cost savings to Medicaid. That was in 2017, that those numbers. So it's more money now that you're saving. We don't score those savings when we budget. It's not real world budgeting. We're trying to get AAA bond ratings. And so we're just putting numbers. This is how much we're spending and this is how much we're receiving this year. It doesn't look at if we spend more this year, we're going to save 10 times as much next year. So the way that we do budgeting doesn't allow us to be smart about how we secure cost savings by how we invest. That's the brokenness in our system. And that's why we hear our legislators constantly saying there's no money in the budget for that. There would be money in the budget if you spent this money this year. We need to get smarter about the way that we do budgeting, because our nation and our state, if we ran our family budgets that way, we'd all be unhoused.
Give an example of that. Walk us through what you're talking about.
Okay, so let's say that we spent $1 million on home and community-based services. So we spend $1 million on adult day healthcare, on case management, on transportation, on meals, whatever that is, to keep people living at home. But next year, we're actually not going to have 40% of that population living in institutions. So multiply that 40 by the $85,000 saved per year by investing that $1 million in community-based services. And that's how much more we're going to have to pour into community services to prevent those institutionalizations. In 2023, ARP did a study and found that 11% of the people living in skilled nursing facilities in California were low-level care. They didn't need to be there. Because we have a broken system, we're institutionalizing people. And because we say we don't have money in the budget, we're not spending money to get them out or to keep them out. But we would be spending a heck of a lot less money keeping them out after that first year. So we are not budgeting.
But I think the other thing to continue this, the both of you covered just about everything. And I think there's a lot missing in that part of the conversation. But what I do want to say is advocacy. We do need to stand up and hold our elected officials accountable, say that very specifically and deliberately, because we vote people in and then we disappear. We no longer hold them accountable. We no longer communicate with them. We no longer tell them what we want. And we need to do that as a society. We, the people with the voices, need to protect the ones that don't have the voices. And that means writing to your legislators. And I know both of you have been involved, just as I have, with advocacy, that we were able to get funding that was supposed to go toward children, then turned back around to come back to the senior population. We've all done it. And it's critically important that we continue to do it, that we educate people, we talk about these issues, and we make sure that the general public knows they have a voice and it's their responsibility to raise it too on behalf of the people that are disenfranchised, overlooked, or forgotten. It's really important. We need to be writing our senators and our assembly members, our governor and our president, and everyone we can think of that could potentially have some impact on policy, that could have some impact on the vulnerable populations that we serve.
Assemblywoman Bauer Kay, who represents parts of Contra, Costa, and Alameda, she was on here and said she wished she had more communication. There's an occasional bill where people rally and send in like 10,000 plus emails, but I really want to hear more from people in my district. If they see a specific bill, I want to get a sense, do 3 people support it or do 20? And she said, we'll get a lot of people who say you need to do more for the climate. But she says, when it comes to specific things, we aren't hearing from a lot of people. They want to hear more from individuals.
I'm on the legislative committee for the California Long-Term Care Ombudsman Association. We are a group of ombudsman leaders across the state who meet on a regular basis. We each get assigned 25 to 50 bills to review. And then we all go back and put them in this big long list with brief explanations, and we rank them. Does this one deserve or merit a letter of support? Is this a oppose unless amended? This kind of thing. And I think that's an easy thing for me to do. It's an easy thing, quote unquote, with timing for me to get involved with that because it's a very clear direction. The general public is what I'm talking about. The general public needs to raise their voices and needs to understand that as a voting member of society, it doesn't just end with the vote. It ends with holding someone accountable and following up, showing up at town halls, sending letters or emails or making phone calls. It doesn't take very long. We were on a Justice and Aging webinar recently that was talking about federal funding and some of the problems around the Medicaid issues. They did the most wonderful thing. They took a 5 to 10 minute break and put a phone number in the chat where everybody on that call, regardless of where they were coming in from in the country, could get connected to their local congressperson. And you call that number, it gets you connected based on your zip code. Someone either answers the phone or there's a voicemail you can leave a message on. It was brilliant. Even if you've never done it before, that was an easy way to do it. It's a matter of helping the general public understand their voices matter. They should be raising them on behalf of the people that can't.
We talk about the average human who's a caregiver, who's the sandwich generation that you mentioned, Jared, before. They're raising children, working full time, and navigating the broken long-term care system to care for their parents. How are they going to have time to engage and tell Assemblymember Rebecca Bauer-Cahan, here's what's going on? They can't. They're trying to pay their bills and care for their loved ones and raise their children. I would flip that script and say, why don't you come out into the community more and assess needs in the community? Come to us. We're paying you. We elected you. Show the truck up and help us out. I think that it's a two-way street. And I think
I would agree with that.
I have watched Susannah at farmers markets. I've watched Susannah, like Susannah is in the community. Everybody knows how to find her, and she shows up at all those events, which is very different than some assembly members or senators who are not in their districts and not listening to people and not asking them about their needs. And some folks don't have the education to read bills that Susannah was talking about. They aren't at that level where they can read through legislation and understand it. I think there has to be a both and approach to that.
I agree with you. I think it is a two-faced approach, really.
If you like this podcast, please leave a review. Let's do quick rounds here. What's one key policy change that you would love to see in senior policy?
I'm thinking of this in different terms, and it's 25 to 50 a week, not a year.
Oh.
But what I would say is not a direct answer to your question, but we were all involved with master plan for aging work. We were involved in planning and looking at all the different aspects of it, housing, transportation, healthcare, and all of those different things. And some really good effort went into these plans. And I did it in Solano County and I did it in Contra Costa. Debbie was involved at the state level. Government appointed this advisory council. Ever since the master plan for aging has been a part of our lives for the people that are working in this industry, there's been solid, heavy duty work, hours and hours and hours put into this. These beautiful plans are put together and they look good and they address how to improve transportation and the long-term care system and all of these things. The big fear is it's going to be something that sits on a shelf. My answer to your question is not as much about what policy I would like to see changed, but more like when you have the experts contributing to something like this that takes so much time and effort, and that really is a comprehensive way to address some of the issues. And we're living it and we're feeling it and we're seeing it every day. And we're telling you, here's what we think would work, right? We just need to make sure those things don't end up on a shelf. They need to be funded. They need to be respected. They need to be read over and over again. They need to be accessible to the public. They need to be understood by the people that they support. That's more what I'm thinking is that direction.
I tell cities when they give me a binder this thick of economic development reports, what are the 3 action items I could help you with so you could actually achieve something, get a Costco? Because those are real tangible versus the binder. Debbie, what's your magic wand on policy? One thing, not 20. One item on your magic wand on policy. Just one.
My item is that you would have to show that you cannot provide a support in the community before you spend money on institution. Before you send somebody to a skilled nursing facility to live, you need to see, is there multipurpose senior services program? Is there Meals on Wheels? Is there an adult day healthcare program? What in the community can support you staying living in the community instead of just paying to institutionalize you? Because we'd rather pay $15,000 a month to have somebody in a skilled nursing facility than spend $3,000 to have you living in community. That would be my magic wand. You have to stop the institutional bias in spending in long-term care.
Matthew?
I'm going to pick on housing. I think most people recognize homelessness as a symptom of a problem. I think where you are on the political spectrum determines whether you respond with either sorrow or anger. But I think it's a symptom of the commodification of housing. It should be a basic need. Everyone needs a place to live, but it's turned into a way to just make money. Corporations can buy up tons of housing, turn it into Airbnbs, and make a profit. But the fact that happens to shove a bunch of people onto the street doesn't bother them. I think some smart regulation of our housing stock is what I'm pushing for. There will be a bill this year, a statewide bill, to give some protections to folks. Our seniors are among those that are most fragile in their housing situations. I don't know what's going to be in this bill. I don't know if it's exactly the right medicine, but I think medicine to keep housing accessible. We know it's broken because we see homeless people. Let's fix it because everyone needs a house. The elderly especially need housing, but everyone needs a house.
I bet you Governor Newsom wishes he had a magic wand to solve some of the housing problems in the state. Check out last week's episode on food insecurity and learn how 1 in 4 East Bay residents go hungry. I want to ask one final question. You guys talked about the need to talk in our schools for adults of middle age now to plan for being a senior. What is your wisdom in short order for them? And we'll go in reverse order this time. Matthew, you're up first. What is your wisdom to tell people to plan for being a senior themselves?
Yeah, I belong to a legal aid. I'm going to say you need to get your legal aid documents in order. You have a will or a trust. You got to have an advanced healthcare directive. You have to have a power of attorney document. Everybody needs those. Jared, if you don't have yours, go.
I put my sister in charge because I know she won't hesitate to pull the plug.
All right. Everybody needs them. It's a universal need, and everybody almost waits too long before they do that.
Yeah. Debbie?
I 100% agree with Matthew. And I will add that people need to plan for older age in their life the way that they plan for a vacation every year. Where do you want to land? What does it look like? How do you want to feel? What kind of clothes do you want to wear? What kind of home do you want to live in? What kind of resources do you want to have? Do you want to be able to go to the movies? Do you want to be able to travel? So think about it like you plan for your vacation. It's a destination. You know where you're going to stay. You know what you're going to wear. You know what the weather is going to be. You planned every single aspect of that. You need to do that with your life. What do you want it to look like when you're 80? And then work backwards from there to plan for that.
I would agree with both of you. When you think about where you want to retire, educate yourself about the landscape in that area, in that state, in that part of the country, whatever it is. Understand what resources you're going to have, what the policies are of the local politicians. I go back to that. I think just really think about what the worst case scenario would be. And I hate to go to the negative, but think about the worst case scenario would be and how you would address it with what resources are available, where it is you're looking to land. So very similar to what they're saying.
Financial planning, look ahead and be prepared. I appreciate everybody being here today and talking about this key important topic.
Thank you, Jared.
I learned a lot. I will recap everybody's name the best I can. Matthew Hulse from Contra, Costa Senior Legal Services, Meyer and Toth from Choice in Aging, and Susannah Meyer from Empower Aging. I really appreciate all of you. Let me know how I can continue to be of help. Jared, wait, don't leave yet. Hit subscribe. Make sure you get the weekly updates. We have a new episode every Wednesday for stuff happening in the East Bay. In the meantime, follow me on LinkedIn, Jared Asch, or check out our firm where we have a weekly newsletter and blog at Capstone Government Affairs on LinkedIn. Thanks for joining us today on the Capstone Conversation.